Well, the first thing I'd say is do it. You don't have to go in with any specific targets or ideas. I think it's more a reflection on the philosophy of your care. We all want to provide the best possible care, and so it's a very useful thought process to go through because you can pick fairly simple things and you can see improvements, and you can do that amazing thing of asking the patient, do they feel like that's improved their care? It's a great idea. It can be fitted into your care plan, your practice plan, your quality improvement plan, and it can involve the whole team.
I guess each practice is individual, but the simple methods are always best. Keeping it simple, having everybody have some input into the planning and to the conversations that need to be had, and focusing it perhaps on a certain and specific area of practice in the first instance. We chose our focus as diabetes because we had already identified that as a quality initiative within our practice, and part of that quality initiative was looking at reviewing the resources and tools that we had available to support patients. Our main priority and what we wanted to achieve was better communication with our patients. We wanted our patients to go away having a better understanding of their condition and where our role was in supporting them.
Gaining an understanding of where people's interest is at and aligning it with some work that's already going on in the organisation. I felt that with an organisation this size, this large, it was useful to not create any extra work but look at aligning with work that was currently in place. In this instance, we used a project in and around the DNAs where there was already an infrastructure and a lot of the work was around communication. So therefore this was an enhancement of what was already underway.
It is important to actually follow a method and a structure, and there is obviously this guide which is out here, so that is, we found it extremely useful. What that does is give a bit of a template to follow and make sure that all the kind of bases are covered. Having a deliberate approach to planning actions and really engaging your staff, because all the team, parts of the team need to be involved. Very difficult to take insights from a health literacy review and only have half of your team being prepared to take them on board. So really important, the teamwork, the leadership of the team. But I think a really important tip is actually for people to be open-minded and be prepared to be challenged.